Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and this is quite convenient for continuous study. I hope you will make use of it. Anyway, in the last class, we have begun a discussion on certain challenges which a pediatrician face, while he is administering Ayurveda medications in children. Due to so many limitations, administration of Ayurveda medications in children is really a tough job. However, children are reluctant to take any type of medicine, even though it is a sweetish one, syrup one. That being the case, the administration of the kashayas, kwatas, chunas, especially in children, is really a tough job. And this series of lectures that will going to give some solution for such problems. In the last class, we have seen some of the basics, how we have to deal in case of infants and as well as neonates for the administration of Ayurveda medications. So today we will continue the same. The concept is Ahara as medicine. Now, a wise pediatrician should always convert the Ahara into medicine. That is one of the best way of administration of medications in children, Ayurveda medications in children. Rightly, Kashyapa told very clearly that Ahara as Mahabhaishajya. Ahara itself is the Mahabhaishajya, great medication or medicine. So by taking this message, we need to convert the medicine into the form of Ahara, and that should be given to the child. Ahara should be modified as medicine. Now, question is how we can modify. Now, for example, certain atypical intestinal problems are there. So, child may be having recurrent abdominal pain, child may be having recurrent bloating, child is having recurrent atypical abdominal pain, colicky abdominal pain. Many times, child is having constipation, child is having diarrheas. Okay, where the exact cause is not identified, we usually call it as atypical problems. So when such problems, you can give the medicine in the form of the Ahara. So Ahara should be fermented. You give any fermented items, fermented food items, because we know the concept of prebiotics, prebiotics, probiotic and symbiotics, where actually we are using the fermented food items or those food items which increase the intestinal bacterial flora. Okay, so such medicines are usually called as prebiotics and probiotics and symbiotics. So we have to prepare a food in the fermented form, and that should be given to the child, and that itself is one of the best medicine for many of atypical intestinal problems, because it enriches the intestinal bacterial flora. Once the intestinal bacterial flora is corrected, many of the 90% of the intestinal problems will be get corrected. We know the concept of gut-brain axis. So fermented food items we have to give to the child as a food. Now this will serve as a food and as well as medicine. Okay, for example, we have got in South India, if you talk about, we have got dosa, idli sambar, idli, dosa, idli, and in North India, if you go for a jalebi, and then we have got dokla. So these are all fermented food items. Okay, so administration of these fermented food items to the child itself will going to give solution for so many intestinal problems. So that in discuss we will again discuss it. Yeah, we will in detail again we will discuss it. Now, nutritional deficits. Many times there are some nutritional deficit is there, and that is a problem. For example, maybe malnutrition or not gaining the weight. So if you ask the mother, she is telling that I am giving 2 glasses of milk daily to the child, but still he is not gaining the weight. Now the question is, 2 glasses of milk she may be giving after diluting it, but how much of calories it is going to give to the child? That is very important, because when you give the more liquid materials, it will going to fill your stomach and may not fulfill the required caloric amount. So instead of only giving the plain milk, I am giving one example, instead of only giving the plain milk, you need to fortify that milk with certain energy substances. Now 1 glass of milk added with 1 teaspoon of sugar, added with 1 teaspoon of, for example, badam powder, added with the 3 or 4 ground nut crushed, added with 1 teaspoon of any oil preparations, example vegetable oils, or maybe the medium chain triglycerides like oils. Now same 1 glass of milk, previously it is giving only 70 to 80 kilocalories, but if you fortify this with this all these materials, it is giving almost 1000 kilocalories. Okay, so that will meet the energy demand of the body, and weight gain will be also proper. Now this is how we have to use the food itself as medicine. Similarly, when you talk about anemias, child is having anemia, you know that, and we have got many tablets, but child is not able to take the tablets or syrups, etc. Now how by food itself you can modify it? Now anemia, there are hemolytic anemias and nutritional anemia. Suppose if it is a nutritional anemia, we know that what is required is, we requires iron, it requires vitamin C, it requires vitamin B12 to some extent, and it requires vitamin C and copper, etc. for some extent. So this is what is required in case of nutritional anemias. So you have to encourage the citric fruits. Okay, citric fruits in the food. For example, it's quite common in Indian practice, Indian food practice, that usually we will take a lemon and we will put it on the any sabji or any dal, etc. And this is one of the best way of supplementation of the vitamin C in daily food habits. Similarly for the iron, so many, for example, coriander is there, palak is there, coriander is there. So these are some certain food substances or leafy vegetables which are very rich in iron, folic acid, etc. Okay, we can make soup of it. Okay, so this is how nutritional anemia can be treated in children simply by modifying your diet. Similarly, suppose if there is a vitamin deficiency, especially vitamin C deficiency, citric fruits are always there. Apart from that, germinated grains. Okay, germinated grains are also one of the best way to supplement the vitamin C. Now, suppose child is having cough, sputum, or upper respiratory tract infection. It is quite common that you can make certain sweet chutneys. Okay, so it may be the ginger, or it may be the coriander, ginger, or so many other things which are commonly used for cough and cold. You can prepare them into chutney and it can be given. So this is one of the basic thing, a very superficial explanation I am giving how we can modify the ahara into medicine. All it depends upon the educational level of the mother and family members. That means those who prepare the food in the home, and also common sense, nothing more than that. Similarly, in certain skin problems, suppose certain skin problem is there where we have to avoid some of the sweet substances and we have to introduce some of the katu tikta kashaya rasas inside the body, because we know that skin problems always we have to take the drugs which are very rich in katu, tikta and kashaya rasas rather than katu, tikta and kashaya rasa, because for the blood purification we require tikta and kashaya rasa. Therefore such food has to be taken, but child is not able to take this tikta and kashaya rasa, very reluctant to take that bitter drugs. So now here also for the skin problems also we have to make the sweet chutney. Now for example, Karela, what we say Karela in Hindi, Kanchalu in Kannada, Kanchalu Hannu. So that is very bitter in taste, but it is one of the very good medic, including diabetes and including pancreatic problems and so many skin problem, because it is having bitter taste. Okay, so that is very good for the skin problems, not only for diabetes and so many other things. Apart from that, even for the skin problems also it is very good. The reason is how you will going to give it. Now prepare the sweet chutneys. Okay, bottle gourd or this Karela, parwal, etc. things, these are having bitter taste, and you have to. One of the best thing is what we can do is bhumi amalaki. So bhumi amalaki plant is quite commonly available in the rainy season anywhere. Okay, so you can prepare the chutney of you can prepare the chutney of bhumi amalaki plant as a whole plant after washing, and mix it with some of the sweetish substances and coconut powder, etc., and churn it, make chutney, and that is one of the best medicine Okay, it is having tikta rasa also. This is one of the best medicine for the skin problem. Not only for the skin problem, bhumi amalaki is also good for the liver. We know that. See, this is how we can modify the medicine into ahara and we can give it. Similarly, for the liver tonic, so many liver protective drugs are there, including bhumi amalaki, and so many other drugs are there. So the leaf of such drugs can be taken and it can be added with the manda and peya. So usually in South India we prepare the rice preparation, and ganji is very famous, gruel, rice gruel is very famous. So while you are cooking, you put the leaves of certain medicinal drug. Okay, so medicinal drugs which are having katu and tikta and the bitter taste, kashaya rasa, and then you consume it. That is one of the best way of administration of the medicine. Similarly, for some of the digestive problems, as we already discussed, digestive problem, idli prepared with the leaves of covering. Now, if you are very acquainted with the South Indian preparations, so they prepare the idli in different way. Sometimes the batter will be kept inside some of the leaves. The leaves which are they using for covering as a cover is also very specific. They use the haridra, hardi. We use haridra leaves. So we make a some pack-like structure by using haridra leaf, and inside that batter will be kept, and then it will be boiled. Okay, baked. So now that is quite beneficial. All the good qualities of the haridra will be imparted into the medicine. Okay, and we know the benefits of haridra. Similarly, kadali patra. Very commonly, the idli is prepared by using kadali patra. Similarly, vata patra. Okay, vata patra. Even the idli is prepared. Some idlis are prepared by smearing that batter on the vata patra. Just roll it and keep it. That is one of the best way. And similarly, tejo patra, etc. will be used. So this is how we can administer the medicine in the form of food. I am giving only few examples. Now, rest of the things depends upon your common sense. Now, twak of certain drugs. We can also take twak, the bark of certain drugs, especially panchavalkala drugs, panchavalkala drugs, and so many other drugs which are having katotikta kashaya rasas, and add it on the rice when it is boiling, and then the manda or the rice gruel what we are taking. So that is enriched with this medicinal property, and give it to the child. Okay, drugs added in the, this is one thing. Another is traditionally what we are practicing is after the puja we used to take the tirtha. In the tirtha we know that we add 8 important substances in the tirtha, including the karpura, tulsi, lavanga, etc. Many things are added, but commonly nowadays it is tulsi is added. Okay, so after doing the abhisheka to the god, the water is collected and that will be kept in a usually a copper vessel, and upon that we will put some of the tulsi pattas, the buds of the tulsi, and then that will be taken as a tirtha. Basically talking, this is one of the traditional religious method, but the medicinal benefits are enormous. You know, tulsi, suppose first of all you are keeping that tirtha in the copper vessel, and we know that the importance of the copper. Okay, it is one of the anti bactericidal, bacteriostatic, every properties, copper ions will be there, and copper is very important for the formation of the RBCs also, to treat the anemia also. Many other benefits are there. Copper is a very important ion in so many metabolic processes, cellular metabolic process. Apart from that, tulsi is the best antifungal, best antibiotic. Okay, it also has got a fragments, so it is bactericidal, bacteriostatic, antifungal, and it also contains traces of acetaminophen, which is nothing but paracetamol. So such a simple technique of protecting the health of the children. Okay, daily you have to take the tirthas 2 or 3 times, so that is sufficient. Gradually it builds the immunity in your body. Now, one more method is how to introduce the medicine to the children in the form of the ahara, that is observe the traditional eating habits of South Indian meals. I have to take separate class for that, it's a big topic. Nowadays we are shifted to the buffet system or this fast food and all, but traditional South Indian system meal taking, you have to watch how the traditional South Indian Brahmins, they used to take the food. They they consume the food in a very typical manner, very systematic manner, which is totally medical based. Okay, totally health oriented. Okay, so that we will discuss. First they will take the Madhura Ahara, then they will take the Amla Ahara, then at the last there will be what you say buttermilk will be there, which is having Tikta and Kashaya Rasas. So it is in a very systematic order. Even it is mentioned in the Samhitas also how you have to take the food. Madhuramashniya, like that, many things are mentioned. So this is how we can change Ahara into medicine. So in the next class we will discuss about Panchakarma in children. Panchakarma in children is one of the very hot topic, and many times there are so many misconceptions about the Panchakarma treatment in children. So that portion we will going to discuss in the next class. Thank you very much.